When I was a little girl, my dad told me that I had found these kittens and their mother in the garage, and so I brought them into the basement. I used one of my baby doll bottles to feed the kittens, and from then on he said that he knew that this was something that was innate in me, something that I wanted to do in helping somebody. In 1968 I had my tonsils out and I was in Children's Hospital. And at that time, the nurses from Presbyterian Hospital had these nursing caps that were huge, and I thought they looked like angels. And when I was discharged, I told my parents that I wanted to be a nurse. I was just so enthralled with them and the work that they did. I ended up, after nursing school, wanting to work in obstetrics. And so for 15 years, I worked in labor and delivery, postpartum, nursery, and just absolutely loved it. I mean, it just really was my passion. But I knew that at some point in my career, I wanted to teach. I had such a passion about nursing and taking care of people when they're at their most vulnerable, because that's what we do as nurses. And I wanted to pass along that passion for nursing to the next generation of nurses. One of the things that I absolutely love about teaching is tutoring. In my opinion, that's where I shine. I love to see that light go on behind the students' eyes, that they get it. If you understand how the body works and what our role is in helping individual patients, then I've done my job. I've been at Hondros for 7 years, and I'll never forget when I first came in for my interview that they said, we have a special population. Well, of course it's a special population. Anybody who wants to take care of people when they're at their most vulnerable is a special person. And one of the things that really touches me is the number of young people that we have who've taken care of a sibling, a grandparent, a parent when they were sick. And that started the spark in them to want to be a nurse. And that's one of the things over the last 7 years that has been the most powerful to me, that here is someone who had taken care of a loved one, and now they want to do it again for somebody else. I think it takes such a big heart to want to do that. Regardless of what you decide to do as an individual, it's your heart that pushes your mind to do what's necessary to be successful. You already have the heart. I can teach you how to get the mind part, the book part of it, so that you can actually do what you believe you're here to do. In fact, a student said this to me, I'm already a nurse, I'm just here to get the paperwork. And I just think yes, I'm here, I'll stay here and help you figure out how to get this done. We knew this was coming, that there was going to be a nursing shortage, and I think it's up to all of us as educators to really up our game to make sure that these young people are prepared to go out there and be the best nurses possible.